there's any questions, if you can then unmute yourself. I can only see 4 screens at the moment. I know there's 16 of us. So if you want to ask a question, by all means do. This is for you guys, really. We've been with this since early January. We've done about 15 different risk assessments on the same subject. So that's how much it's changed in that time period. Some of the things that you're hearing at the moment came out in Italy and in China in January. But we've sort of kept a sort of finger on the pulse for that long. So we'll start. So welcome to the presentation. All the information on this presentation either comes from our experience of going out and doing it, some sort of governmental body like the NHS, regulatory like the HSE, or something like IOSH, the Institution of Occupational Safety and Health. And it's all about getting you guys to understand exactly what this means. Presentation will take around 60 minutes, and that's with questions. If you've got anything specific, my email's on here. Just email me and I'll try and help you out and give you some free advice if I can. Every workplace is different. But what we all have to take on board is that a COVID-19 free workspace is going to be very difficult unless every one of your workforce is COVID free and every single one of their partners, members of family is COVID free, and everybody they meet outside of work is COVID free. So that's a pretty tall order. So what we're looking for is a risk assessed workspace with control measures that are in place to prevent COVID-19 exposure. And the control measures are as they are there: health screening, distancing and hygiene, physical barriers and screens, information on COVID-19, procedures for those at extra risk and reporting of that, communication of feedback, review and improvement. And as this has gone through the country, there's been lots of things come out which sometimes haven't been helpful at all. And from my point of view, all I can do is report back what we know. I've been into London to look at a construction site there and help them with their COVID-19 systems, which are very good, but they will still get exposure to COVID-19. So what is COVID-19 coronavirus? Well, it is a virus. So antibacterial gel won't work unless you've got alcohol content over 70%, which is quite high. Soap and water is by far the best thing that you can use. And as you can see, it gives you real proper breathing difficulties. It affects muscles, it affects vital organs that we've found out in the last week or so. So what we're looking at is a high temperature, that's something over 37.5 degrees C, continuous cough for 3 or more coughing episodes for 24 hours, and a loss of taste and smell. The loss of taste and smell was found in China and in Italy in January, so we've had that on our risk assessment for a long time. If you want to go on the NHS website and look at what they advise, it's there. Simple as that. The one thing that we need to be aware of is a duty of care to all our staff, anybody who comes into the workplace, anybody who is affected by our operations and activities. And within those people, we might have somebody who needs a greater duty of care. And this is where we start having some of our issues with risk assessment. So from my point of view, I want to know who is extremely vulnerable and a high risk group, and they're on there: organ transplant, chemotherapy, intense course of radiotherapy, or clinically vulnerable, 70 or older, pregnant, have a lung condition, have a heart disease, or have diabetes. So most workplaces will have some of them in it, and they should be isolating unless they're told by the medical practitioners that they don't need to. So that's the first thing we need to think about. Does anybody want to come in there and ask a question? Yeah, if you want to ask a question, just unmute yourself. And
Steve, can I ask a question?
yeah.
So I had a conversation with a client earlier today who has an employee who has multiple of those moderate risks, so clinically vulnerable. They are an older gentleman, just short of 70, but they have had serious heart operations within the last 18 months, and they're also diabetic. They are adamant that they have not been provided anything by their GP to say that they should be shielding, and they are pushing to return back to work. And the client is obviously very concerned, and it's a view that actually no, because we know of those conditions, we want something from the medical practitioner to say that they are fit to return to work. Is that right, in the absence of them providing anything from the NHS?
Yeah, so I wouldn't. Yeah, so you can do one or two things, can't you? You can go on the helpline and ask them, and they may give you some advice. You can ask your occupational health provider, yeah, or you can write directly to their GP and ask them, so they are fit for work. Because coming on a bit later are the reporting procedures that you've got to put in place that come from the HSE, and the wording on there is not helpful to anybody who has any one of these issues and gets COVID-19, and it will put the owner of the business in a really sticky situation.
Yeah, so my concern is that when we write to GPs, it can take anywhere up to 4 weeks anyway, and the time scale is how long is a bit of string in regards to getting a response within the current conditions. I don't think we're going to get a medical report. So from a duty of care perspective, through a discussion with the client, actually they are going to remain on furlough, and it's not really going to be an option until they provide us with something to say that they are not shielding and they are fit to return to work. So we very much push it back to the employee.
Yeah, so this screen comes directly from the NHS website.
Fab, thank you, Steve.
Yeah. All right, anybody else got a question? If they have, can you just unmute yourself and come in? Okay, that being the case, I'll move on then. So risk assessment. So when we do a risk assessment, we're always trying to eliminate the risk to start off with. And obviously we can't, because we can only do that through vaccination, and only when that vaccination is proved to be working well. Next is substitution, replacing the virus with something less harmful. That is not possible either. Engineering controls, well, some people are thinking about piping air in and pulling air out. Well, as we know, COVID-19 is transmitted by water droplets. So if you're in an environment and you're taking out that air that's got the water droplets in, where is it going to? Is it going to a safe place? And if it's just going onto the pavement or somewhere outside into a shared space, you might be infected somebody else. So again, that's really, really difficult. And the best thing you can do is actually do a risk assessment and consider everything in your workplace. Yeah. Now we have to prevent foreseeable risk if it is life-threatening. In fact, if it's injurious in any way, and COVID-19 is, and we cannot work today in the manner we worked prior to the COVID-19 outbreak. It just doesn't exist anymore. Yeah. So people who think that they can go into the workplace and jam people together and do things and get people to make 12 cups of tea and that type of thing, that's gone out the window. That doesn't exist anymore. Not until there's a vaccine that works for COVID-19. So if we're thinking that way, thinking we can get back to normal, believe it or not, this is the new normal. This is the normal until we get a vaccine that works. And that's what we need to be thinking about. That's why we need to change, and that's why we need to do things in a different manner. So what is a hazard? It's the virus. It's killed over 39,000 people in the UK as of today. Spread by minute water droplets that's expelled from the body through sneezing, coughing, talking and breathing. It can be transferred to your hands and from there onto other surfaces and whatever. It can survive on surfaces for long periods of time, depending on the surface type, its moisture content and temperature. The best surface to kill this thing is brass and copper. It only lasts about 4 hours on there. And if you remember in the old hospitals, they were full of brass and copper handles and plates and everything. They're all now gone for stainless steel and plastic. It can stay on there for 24, 48 hours. So we've got a problem on our hands, and we need to, and that's why washing down surfaces is a big control measure in the way that we need to tackle this. The likelihood, well, the likelihood is difficult. I've been to lots of different workplaces. They all do different things in a different way. But first and foremost, we need to ask the question, can your staff work from home? Because that has got to be the first thing on any risk assessment. Whether the boss likes it or not, whether the financial director likes it or not, we need to think, can our staff work from home? Now, if they can't work from home because they're doing a physical job in a workplace, then that's different. But if they can, that's the first thing that needs to be on that risk assessment. If it's not, you're taking away one of the biggest factors to the coronavirus dropping to the levels it had so far in this country. So that needs to be the first thing on your risk assessment. And then we need to think about how we might employees meet people with disease, how frequently, how long, how do they travel to work, who have vulnerable medical conditions, who's in their households. Yeah, if someone's employee's household must isolate, what will you require your employee to do? I've been hearing things where directors of businesses have been making decisions outside of what the NHS guidelines are. Yeah, where their partner's got coronavirus or been diagnosed with it, and they've put them straight back into the workplace. So again, you know, we need to think about what will happen when the fat hits the fan and somebody reports you. And then other issues like meeting people who have the disease, and does this increase exposure, confined spaces, etc. We're coming to a time in the weather cycle where we've got a lot of sun, which does help with this disease. When we start getting into the wet, cold times again, then I expect it to go up if we haven't got a vaccine, because it doesn't like sunlight, it likes moisture, and it likes the cold. And then designing your workplace. So what I've done is I've just used some color coding here because there's a lot of information on these slides, which I'm sure Pete's going to share with you. The blue bits on there are sort of asking you to do something. The red on there is something that's going to be difficult for us to do or putting you in a position of risk. So can you maintain social distancing? Can you spread your employees out? Can you reduce the number of employees required to work in an area? So last Friday, somebody rang me up from London, and they're spending sort of £450,000 a month on their offices. At the moment, everybody's working from home. They've given them the opportunity to stay working at home. And majority of them, I think they've only got one who wants to come into the workplace, so they've got a problem with that. What they're doing is they're spending £50,000 on kitting them out at home with desks and chairs, and then obviously they'll be saving about £6 million through the year, and having meetups every 2 weeks, whether online or in a place when we can do. So again, we need to think about how can we do that. I know some companies are asking their employees to go in 2 days a week instead of 5 on different days. So they've got different teams, red, yellow, green, blue teams. So again, we need to be thinking outside the box and thinking flexibly. I'm in my training room, and we could get 12 people in this training room quite easily. We can now, through social distancing, only get 5. It's as simple as that. So we all have to think about this 2 metre social distancing. And in the workplace, we need to have that marked out somewhere as what 2 meters looks like. Because I don't know if anybody can tell me what 2 meters looks like. So, Nikki, you're about 6 foot, aren't you? So if Nikki went like that, yeah, arm, fingertip to fingertip, that would be about 2 meters. Yeah, so that's a pretty big space. Yeah, so again, you need to work out what that is. Phased break time, staggered start time, staggered finish time. So we know one company that's starting at 7:30 in the morning. They've got 4 shifts coming in. They're having a staggered lunch break, 4 shifts, and they're having a staggered leave time, 4 shifts, and then they're rotating that round. What hand washing and sterilisation facilities have you got around the workplace, and which areas do people commonly touch? Yeah, so we have to start thinking about those sort of things. They're quite nitty gritty, but they're fundamental to getting the risk assessment right. Cleaning. So what's your commonly touched surfaces? So we're on the 1st floor in Minerva House. We've got 2 handrails going down, and every day they're cleaned twice. Full stop, with bleach, because that's where people put their hands. That's one of the most commonly touched areas in the building. Have you got an effective strength of cleaner to kill the virus? Have you got any check? We know one company that does a cleaning checklist. So they go around and clean the areas and they mark it off. Who did it and what time and how frequently? Your cleaners, if you employ contract cleaners, remember you owe them a duty of care. You can't literally say they're my cleaner, therefore it's up to them. If they're in your workplace, you are responsible for them. Like viral loading on cloths. So again, you know, you might turn around and say they need a new set of cloths, you know, twice a day, depending on the amount they're cleaning. Yeah, and where do you dispose of those contaminated cloths? Well, they can go into your bin. I'd just soak them in bleach or something, because bleach kills it dead. Work equipment. So this is another sort of an area where we've got some issues. Yeah. If it's allotted to an individual, then the individual can keep it clean and he won't be spreading anything. If it's being shared, then you need to deep clean that equipment. Now, computers don't like to be wet. Full stop. So you've got an issue there. Desks as well. If you're hot desking, your chairs that you're sitting on, how are you going to deep clean those? Because it won't just be the top surface, it'll be the legs and the undersurface as well. So again, what deep cleaning processes do you have in place? And then what hand washing and sterilisation facilities have you got? So in our office, before you come in, whether you've gone out to the car or whether you've been to the loo or whatever, you have to wash your hands. Yeah, because it's transmitted really easy, and we touch our face quite often, and that's what will spread it. It'll be on a surface, you touch it, you touch your face, all of a sudden you're in a risk category. You're going to start thinking, if that goes into your mouth or in through your eyes, again, you've got a problem on your hands there. So we're looking at a safe system of work. Yeah. Does anybody want to say anything before we start on this safe system of work? If you do, just literally unmute yourself and ask me a question.
Steve Pete, are you okay?
Yeah.
Thanks for what you've covered so far, Steve. One of the things that we've been struggling with, similar to yourself, with the training room, our training room has capacity for up to 12 people, but we're now in a position with social distancing where we can only have really 5. And that then has an impact on business, because all of a sudden capacity is reduced by less than half, and you've then got some severe impact on business. But nonetheless, one of the things I wanted to mention around the vehicle cabs, so where possible, my clients have been keeping vehicles to individuals, but actually they've employed people to go in and do a full clean of the inside the cabs when vehicles are being swapped over, which I thought was quite interesting. But what my question for you, if possible, Steve, was around the mask. Are you gonna? I can't remember if you're covering PPE, but
Yeah,
we'll got a face mask later on.
Yeah.
Okay, thank you, Steve. I'll mute myself then.
Yeah, we'll talk about masks later on. The joys of masks. Yeah. So social distancing? Can you reduce the risk by working side to side or back to back? Hairdressers, they won't be doing very many at all face-to-face cutting when they come back. It'll either be at your side or behind you. Minimal PPE, face shield, medical mask, depending on the work. So the big thing that people don't seem to understand, as far as I can get my head around, is that when we're face to face within sort of a meter, and we're talking to each other, obviously there is water droplets that is coming out of our mouth. You're 30 times more likely to get COVID-19 from somebody who is a meter away than from somebody who is 2 meters away. So we start looking at, right, what do masks do? And we've all seen the different types of masks, and I'll just nip out and get the sort of the Darth Vader 3M sort of one in a minute. What we've got to think about is, what is the mask primarily for? So if I wear a medical mask, it won't stop me breathing in COVID-19. It will stop me giving it to you. Yeah. So that's what that type of mask, whether it be paper, whether it be cloth, all that type of thing. Yeah. The only mask that will stop COVID-19 is what's called an FFP3 mask. And that's because the aperture size is 2 microns, which means that the COVID-19 virus can't get through the filter. So from my point of view, it's about how this works. In reality, do you want to wear something that will stop you from spreading it? So I haven't had a test for COVID-19, but we've done a lot of work in London in sort of September, October, November, December. I had a terrible bout of flu for about 5 weeks with all the symptoms of COVID-19, including the high fever. So I think I've had it, but I don't know. And that's the other issue that we've got on our plate at the moment. Because if somebody knows they've had it, you're in a different position in your workforce than if you don't know. And that, is, again, is a problem. I'll just nip out and get a mask, and then I'll carry on. I'll be 2 minutes.
So has everyone prepared their workspaces ready for return to work, or are people already returning to work with social distancing happening?
Hi Pete, it's Nell from Ankorders. We are remaining working from home. We've found we've managed okay. I think we missed the social contact to start with, but we're following the first question, can you work from home? And we're proving daily that we can, so we continue to work from various locations around Peterborough.
Absolutely. Thank you, Nell. Steve, back to you. Sorry, I was just asking if anyone had already got a process in place for distancing at work.
Yeah. So this is a sort of an ordinary cloth mask. Yeah, when you put it on. Yeah, all this does is stop me from spreading it to you. Yeah, that's all it does. If the COVID-19 gets on the front of this, I can breathe it in and I'll be infected. This is an FFP3 paper mask. Yeah, so this has got the right size aperture to stop COVID-19, but that is really difficult to breathe through, and it's only valid for about an hour. This is an FFP3 mask with filters on it that you can self-check your seal. From my point of view, if you're working in close proximity to somebody that's less than 2 meters away, you need to have one of these. Because the one thing that you can do is self-check and make sure that you're getting a good seal. And you can breathe in this normally. So you can wear this for 8 hours. It will not affect your breathing, whereas this one will. The difference in price, really, 2 boxes of these equals 1 of them. And this you can keep the filters on for over a month. So that's what we need to be aware of.
Steve, are they available, those masks? Steve, are those masks available?
They are starting to come through now, yes. Yeah, I wouldn't want anybody in the workplace to wear one of these. Yeah, and the reason why I wouldn't want that is because you're relying on the individual to actually turn around and do something correct every single time. And as human beings, we're not good at being 100% consistent. Yeah, and on our risk assessment list, personal protective equipment is the bottom tier of the hierarchy.
Yep.
So, safe people. Yeah. Who do we know is harbouring the disease? Now, some people may be something called asymptomatic, in which case they've got the disease, but they're not showing any traces of it. They've got no cough, they've got no fever, they're perfectly all right. And those people can spread this. So we don't know. I think what everybody needs to do is something called health screening. And if you look through the government guidance doesn't give you 100% of what you need to protect yourself and your business. It's about 60 to 65% of the information that you need. I think you should be asking all your staff this. Yeah. So in the last 24 hours, have you lost your taste, lost the taste of smell, and raw temperature? If they say no to all of them, I think you're okay. If they say yes, you then need to take their forehead temperature with one of those non-contact temperature gauges. Yeah, and anything over 37.5 C, you need to send them home. Yeah, because you need to do something before they enter your workplace. Now, we have given advice to companies and said, you know, if they clock in, if they sign in, that needs to be there. And by signing in, what they're saying is, I've got none of these symptoms. And briefing that out to the staff so they take some responsibility for this. Because you can't have a policeman doing this. People need to take responsibility for this. Yeah. Now, if they go home, they need to report their illness. Yeah. They might have to do some tests with the NHS. Yeah. All right. So they might be off work for 7 days and their family for 14 days. But again, you want some procedures for that to help you do that. And one person in the workplace who's spreading this disease, bearing in mind that if I cough and it goes over a screen, so I've seen some desk screens that are only 600 high. So as I sit up like this, I can cough straight over the top. They need to be higher than that. It could go from one end of the office at least 3 or 4 or 5 meters before it actually comes down. And if you think about a sneeze can go 20 foot. So again, you've got to think about that. How does that work in your working environment? How are you going to get that message across? Because we're going to have to. It's there. So you need to do some health screening. PPE. So this is where the red bits come in. If you give people gloves, for me, they're like a sense of security that is not sound. Because I've got gloves on, I can't catch COVID-19. You can. You can still touch your face with gloves as much as you would do without them. Yeah. And because they're on, they give you a false sense of security. Yeah. So, you know, from my point of view, I don't like people wearing gloves. I'd much rather they wash their hands more. Yeah. Paper mask, again, we've gone through that. It stops it being spread. But again, yeah, it doesn't protect you. If you give people paper masks, then you've got to give them a receptacle to put them in. Because if you leave them in the workplace, they might actually be spreading the COVID-19 virus. So again, what receptacles are you going to put them in? And then what sort of disposal regime are you going to put in place for that? And who's going to do it? Because they're going to have to handle these, yeah, and get them out to be disposed of, yeah. And plastic aprons, yeah. Well, I've seen loads of plastic aprons that go straight down the front of your body, but hardly any that protect your arms. So again, it's that whole thing about how do we get the right systems in place? So PPE, personal protective equipment, from my point of view, in the workplace, it should not be relied on. It's not the best thing that you can do. Health screening to start off with, and then look at social distancing. Yeah, okay. So on there, FFP3 mask, I'll put that down. The science isn't really brilliant around PPE. It'll be far better once we've got through this coronavirus. People will understand it better. If we seek to control exposure, then we're in a much better place. So prevention is a much more effective principle and doesn't rely on the individual. Yeah. And from my point of view, if you rely wholly on an individual, there will be an incident down the road. Full stop. It may reduce employee anxiety, but it's not, I don't think it works that brilliantly. So other considerations, we've got 20 on there. We spoke about some of them. Traveling to work, we need to, if we was in London or if we was in a shared transport system, that would be pretty big. If they come in their own cars, fair enough. If they cycle, even better. But again, you might want to do a survey in your workforce to find out how they're coming to work. It's pretty pointless you putting all these systems in place and 4 people share a car and come from 4 different households. Yeah, if there's 4 people in a car, they need to either live together, yeah, and that is the only excuse they've got for traveling 4 in a car. So sharing a ride has gone out the window. Parking, how do we get 2 meters social distancing in our car parks? Yeah, we've got to put the showing 2 meters distancing in the workplace. That can be on the wall, on the floor. We see it in Tesco's, we see it in other places. Screens and barriers. So I've seen some horrendous prices for screens. One of our clients actually went out and bought 7 or 8 clear shower curtains and then hung them from the ceiling in their office, yeah, and velcroed them to the desk. Yeah, and there's no way that if anybody sneezes from their workstation, can that go to anybody else in the office apart from on that screen. So we've seen some that are pretty low. Some of the screens that are pretty low, they need to be quite high, because if you stand up and sneeze, again, you might be affecting somebody who's across the way from you. So what you need to be doing is, instead of having people face to face, is trying to stagger them round. Yeah, so they're not in front of each other, if we can. Close working procedures. We need to identify these, and what I want to do is bring people in on this. So can you think about anywhere in your workplace where you've got close working going on or needed? Can you just bring it up for me? So can you unmute yourselves and just tell me if you've seen any areas that you will need to do close working in? Anybody?
Yep, Steve. So a two-man lift on house removals, for example.
So a 2-man lift closer than 2 meters. That's a FF. That's one of the. That's a FFP3 mask. Anybody else?
Hi, Steve. We're an organisation that do design and build. So we have a welding area, we have a saw area, and we will have this struggle where we are going to have employees. Well, we're trying to do a one-way system, but obviously sometimes when you're doing design and build, you might have to do a bit of welding, you might have to do a bit of saw or a bit of CNC machine. So we are going through the risk assessment, but just wanted to give that as an example.
Yeah, so that's quite a difficult one, because it's It's usually work that doesn't lend itself to not working 2 meters apart. You're going to have to identify now all the areas where this could happen, write them down, and then you're going to have to turn around and put in a safe system so that the guys understand that they don't just ask for a lift or they ask for help. They have to put on their PPE first, and then they can move it around. With all these masks, there is a face fit training course that they need to go on as well, which takes about 40 minutes. But without that, again, the business owner is liable under COSH. Anybody else? Okay, we'll move on then. So one-way routes around the workplace. That's another one that we need to think about. My workplace isn't set up for that at all, so I can't do that. Welfare. So welfare, probably the highest contact area will be somewhere near the kettle, I would think, in the sink. So again, we need to think about how many people you can allow there at any one time. And once that person's been in and got herself a cup of coffee or a cup of tea or whatever, you need to have some sort of cloth there so they can disinfect it down for the next person. Because basically it's a one person, one clean system. That's what we need to do. Toilets, we need to put numbers on toilets. Because if you can't get 2 meters social distancing, then only one person is allowed in that toilet. And that needs to be a sign on the outside as well, so that all people know what they should be doing. And we've spoken about PPE, cleaning. We've been using quite a lot of flash with bleach because that's easy to put on a cloth and get round. That kills it dead. You can use soap and water. That'll kill it. Antibacs with high alcohol contents. I don't know whether you want that in your workplace or not, but that does work. In cars, people have been taking quite a lot in cars. There's been some fires with the alcohol in the cars where it's evaporated because of the hot weather. So again, that's another one you're going to have to put on your risk assessment. Individual hygiene. So again, getting people to wash their hands at regular periods. If they move from their workstation to an area, clean their hands before they come back. Cleaning their workstation, making sure their workstations, the surface areas are clean. Your windowsills, any spare desks, chairs, any surface that this thing could sit on, really. Where it could live. So again, you're into that. And then when you've thought about that, you can then think about putting a risk assessment together. So I would do all the work for the risk assessment up front, and then I would put it in a risk assessment and a safety procedure. You'll need to communicate that to your staff and others. So it might be contractors, it might be visitors, and get a sign off to make sure they understand what they should be doing. So there's quite a lot involved in this management of COVID-19. Basically, as human beings, we're a fantastic transport vessel for this virus, and we can transport it on any part of our skin. We can disperse it through the air. So again, we're a really good transport organ for it, and that's what we need to be thinking about. Pete asked me about HSE guidance. Well, the HSE actually pushes you to the NHS and the government websites. So from my point of view, the HSE will be using those websites as their information point. We know of one site that produces food for us. They do fruit and veg. They had the HSE round one day and they gave them a clean bill of health. They had the NHS round another day and they slammed them for not being good enough. So even our inspection authorities are not on the same page. All you can do is do your best, and if you're not sure, seek competent professional advice. That's all you can do. because if you're going to guess on this and you guess wrong, it could cost you an awful lot of money, and it could get your boss locked up. You need to look at this as a bit more severe than asbestos, because asbestos has got a 20-year latency period. This has got 7 to 14 days latency. So you need to look at it a bit like asbestos. HSE reporting. This is what I was talking about earlier on. This came out a couple of weeks ago. So you've got to make a report to the HSE. An accident or incident at work could have led to the release of the virus. So that's in a lab situation. This is the one, the next two will affect us. A person at work has been diagnosed as having COVID-19 attributed to an occupation exposure to coronavirus. This must be reported as a case of disease. And then a worker dies as a result of occupation exposure to coronavirus. This must be reported as a work-related death. So this attributed to phrase, or as a result of, if in your workforce you've got somebody who's had COVID-19 and your risk assessment and safe system of work do not meet the current guidance criteria, that will be seen as being reasonable enough for them to say it happened at work. Does anybody want to come in now and ask a question?
Steve, it's Katie here. I've been monitoring the group chat. There's a few different threads, a few different conversations that have been going on. One about clothes. Do you have any idea how long it lives on clothes?
Fabrics, 4 to 8 hours, depending on what the clothes are made of.
Ah, right, okay. I was just interested in Bev's comment. Bev, do you want to unmute yourself and just talk through?
Yeah, it's just a comment that my daughter said when she, my daughter's a key worker, so her daughter's been going to school for a little while anyway, but it was their first day in sort of proper going back to school today. And one of the guidance was that they must wear a new uniform every day. Now, probably that is true anyway, most people would. I was just thinking if people wear uniforms and the uniform is limited, maybe they don't have enough uniform, would there need to be guidance around, you know, you must wear a different uniform every day. You can't let one set of uniform go for 2 days, for example.
From my point of view, you should have a new set of clothes on every day. Simply because we still don't know what this. I mean, we've had surfaces where coronavirus has lived for over 48 hours, and if it's in damp conditions, if your clothing's a bit damp, it may live on that. They say between 4 and 8 hours on certain clothing. So on plastic, it's up to 24 hours. Same as steel, up to 24 hours. If it's in a moist environment, it's a bit longer. So that, again, it can be quite a difficult thing. That and because we don't have all the information, and because all the HSE are looking for is a reasonable case of transference, that puts us in a difficult situation. So I would say a clean set of clothes every day.
Yeah, I guess that might mean that employers need to provide additional uniform if people are struggling to sort of get their uniform cleaned overnight, back ready for the next day. I mean, you'd think most people would wear clean clothes every day anyway, but I certainly know people who I've worked with in uniforms that didn't. Yeah.
Yeah, it is a difficult one. Nell's business, where she has people who do welding and that type of thing, you know, a new set of overalls every day could be quite difficult to get through the washing machine and out the other side. But again, you know, do you spend 40 to 50 quid on your workforce now to protect them later on? That's the equation you need to make. I know what we do, you know, do we look at it long term really? If a set of clothing is going to last them 2 or 3 years, then it's worth the cost, but other people won't make that decision. So anybody else?
I know Michelle had a question about donning and doffing procedures. Is that something you're able to cover, Stephen?
Yeah, so can we get Michelle on?
Are you there, Michelle?
Sorry, yeah, my computer went unmute then. That's really strange. Yeah, it's just about taking the mask off and on, because obviously you hear a lot in the news and things about cross-contamination of doing so.
Yeah, so if it's just a mask, if I show you, if it's just a mask, then basically what you want to be doing is taking this off right next door to where you wash your hands. And where you take this off and you dispose of it wants to be close together. So what I should do is wash my hands first, then I should take this off because I'm touching my face. Take this off from there, dispose of it, and then wash my hands again. Okay, great. Yeah. If you're wearing gloves, because gloves, there's a test where they put some treacle on somebody's gloves and said wear them for a couple of hours and come back, and the treacle was literally everywhere because of what you do with your hands. So if you're wearing gloves, again, you've got to be right next door to where you're going to wash your hands. So you take your gloves off, you wash your hands, you then take your mask off, put it in the bin, wash your hands. So at each time, the accident and emergency teams and the people who work in COVID-19, it can take them between 6 and 10 minutes to take off their PPE. At each stage, they wash their hands. So again, and again, we're not used to that. So it's a new habit that we're going to have to form. And some people are quite good at forming new habits, and some people aren't. Any other questions?
Thanks, Steve. I've got a couple of questions that have come on the chat to me. One of them is around, is there do you have a template potentially sign-in form that, for an employee to say that they've not had COVID-19 symptoms, or is there a template that they should use?
So once you get these slides through, you can use the wording off these slides. Yeah, for the health screening.
Yeah.
You can use that. That's not a problem at all.
Well, thank you, Steve.
Yeah, and like I say, if you need any specific advice, give us a call or send me an email. We're giving out lots of free advice at the moment.
No worries. And then there was one question around one of the people on the call's partner works in a warehouse. A lot of people pick and move various items. Couple of hundred people working on site at any one time. What would be the best measures for them to put in place? That's probably quite a complex one. Would you agree, Steve?
Yeah, so what I would want to do is get up quite high and have a look along the bays and see the interaction points right from the start. So I wouldn't make any judgments at all until I could map out and see exactly where the interaction points were. And then you need to design your risk assessment and your safe system of work around what's going on the shop floor, because that is such a complex way of working. Pick and place systems are all about the individual having the flexibility to go and do something in the shortest possible time. That might need adjusting a bit. So it's quite a difficult one, that. Okay, can we carry on or not?
Thank you, Steve. Just one more's just popped in around sharing vehicles and what protocol should be with the sharing of vehicles.
Sharing vehicles. So yeah, so again, it's like I said earlier on, if you've got 4 people sharing a vehicle and they don't come from the same house, then they shouldn't be. Yeah, okay, the only people who can share vehicles are people who live in the same house, or you give them a good old FFP3 mask and you train them in how to wear it. Now, the one thing about FFP3 is this: if you've got a beard, these are useless, absolutely useless. You've got to be clean shaven the night before or the morning that you're going to wear them. And if the HSC see somebody wearing a mask like this and they've got stubble or they're not clean shaven, that's a prohibition notice on the company straight away. So again, you need to be aware of those subtleties and get some expert advice if you're going to start thinking about using these with anger. Okay, we'll move on then. So reassurance, how can we, one of the other questions, Pete, how can we reassure our workforce? That is going to be very difficult. We're not getting any clear instructions from Her Majesty's government. You saw the Dominic Cummings issue the other day. And in reality, they're bringing the lockdown out when we're still getting about 500 or 600 new cases of COVID every day, and that number hasn't changed for a long period of time. So the transmission rates are still the same. So what can you do? So you can set out some clear instructions of what you want from your team. Set out clear management actions of how the workplace will be made safe. Yeah, so this is no different than you getting a major dangerous piece of plant on site and allowing people to work on it without the guards being in place. It's that dangerous that you've got to be taking these actions. You've then got to monitor and manage the workplace, and then communication. So I've put just 4 on there: briefs, toolbox talks, inspections, and input from staff. You might want to do surveys. There's lots of things you can do. It's all about talking to people and getting them to understand what you're doing to make the workplace safe. And if somebody puts their hand up and says, "Excuse me, I've seen this," what we need to be doing is taking away this blame culture. So there's no blame in this. We've all got to change our habits, and that's going to be difficult. So to make that happen, we've got to do lots of reinforcement, so you can get feedback from your team, change your workplace habits, and then that hopefully will reduce the fear with facts. And if we can put facts in the way, hopefully people will pick up on that and move it forward. You could make your workplace risk assessment a team event, so get people's input. Review the risk assessment weekly, monthly with the team to keep them on board. A little nudge to make sure they're in the right place. Workplace COVID-19 survey. You can ask them when they come in at the start how confident they are that the workplace will be kept safe. 5 or 6 other questions, and then again afterwards. And you can also put up the "You Asked, We Did" boards. So these are rife throughout the construction industry, and they've brought down fatalities tremendously. But again, we're in this confidence thing. We need to get people confident. So if somebody brings up the fact that they want a face mask to work on their workstation, fine, it's not an issue. Yeah, if they feel safe, that's fair enough. All they're doing is they're helping the spread of it, so it won't stop them from getting it, and giving that information so they know. Anybody else got any other ways that we can reassure people? No? Okay, let's move on to the next one then. Home working. So again, home working, we need to get new habits. Yeah, so how do we do that? Can we have remote team member management systems? They call in every day. They work on visible systems, so they're all on a checker plate on a computer, and they can keep the team working. Yeah. Can we get their workstation setups properly? So again, they're working comfortably from home. Have you got a picture of that to prove that it's set up properly? Have they spoke to their family about what the clear working protocol is? Team communication and team well-being, how do we get that in place? Who do we talk to? Getting information on that. There's lots of that now. Visual meetups, we're doing that now. Individual training, which again, to me is a big thing. We want to take what they did in the workplace and just transfer it to home. So if they were going to do training in the workplace, how can we get that so it's done at home? Individual reviews, and then again, a "You Asked, We Did" at home system. So I think IKEA will be selling a lot of office furniture because it's quite cheap and it's quite robust. But again, you don't have to spend a lot to get this right. One of my final slides, this came out in sort of March. Yeah. So if people can work from home, we need to help them work from home. And that's it. Have we got any other questions? No?
Steve, I've not got any in my chat. I think we've covered them all so far. What about you, Katie?
Yep, same. I think everything's been covered. Thanks so much, Steve. Unless anybody's got any final questions, feel free to come off mute if you've got any final questions for Steve.
I've just got a bit of a, I don't know, not particularly a question, Steve, but one industry that there seems to be lots and lots of concern around, and I know you did touch on it very briefly earlier, is about hair and beauty. Just because of the close proximity in regards to hair, but also treatments such as waxing, such as nails. I'm thinking about myself. I can't wait to get into a salon. But I've had some questions kind of asked of me, and you know, I would always kind of refer over to yourself because you're the expert rather than me. But there's lots of discussions around, oh, actually, we need to invest in lots of the drop-down plastic, which I know you've covered, but for me that doesn't stop the physical touching of the hands. It doesn't limit it. So actually, it's around promoting good washing practices and stuff. Is there any kind of hints and tips, like especially for hair and beauty? Should, you know, is it worth them looking at the protector screens, or actually is it save your money and just buy more kind of antibacterial or whatever it might be? Anything like that?
Yeah, so from my point of view, you would need to again map out where the interaction points were. So I'd make the person having their haircut put a mask on, right? Because at least then they're not spreading it to you. I would probably also get the hairdresser to put a mask on and a face shield, because the face shields come down below their chin. And then everything has got to be working at the side and the back. You know, hardly anything at the front at all. And then you've got to think about a salon. So a salon is one of the most moist areas there is. Yeah. So when people come in and have their hair washed, are you going to blow dry? Because once you put a blow dry in there, you're going to put everything up in the atmosphere again, and it's going to come down. So again, I think there'll be quite a lot of wet cuts done, and things like that, because that would be a way of reducing the risk in that environment. There might be more extractor fans, but again, the workplace will then become colder, and so will the experience. So again, it's going to be quite difficult. Every time the hairdresser, the stylist touches somebody, they're going to have to, once they're finished with that person, they're going to have to wash their hands. Then they're going to have to clean down their workstation before the next person comes in. So again, that person's hand they're going to be really raw. So getting the right type of replenishing oils in and soaps and things like that. You don't need high quality soaps to kill this. You know, low quality soaps that don't hurt your skin so much will kill it. So again, it's just getting the right stuff in, and then making sure that I reckon dermatitis is going to go through the roof in salons, because you will have to wash your hands 3, 4, 5, 6, 7, 8, 9 times a day. And then when you're cleaning your workstation down again, you're going to get that cleaner on your hands as well. So again, how can we make it so that it works and it doesn't impair them? Once they start putting gloves on, we start having problems then in other areas. So again, it's that.
In regards to nail technicians and beauty therapists, are you saying that actually, even though there's skin contact, holding hands or touching the face from one person to another, gloves probably isn't the best? It's still around.
Yeah, I would. So again, I've got to think about this from if it was my wife doing this now thing, right? Because if you put it from somebody who's close to you, you start getting the right side of it. So I'd get my wife to wash her hands and the person who she's doing the nails with to wash their hands. That's the first thing. I'd probably have a screen up so they put their hands in like a letterbox through the screen. Yeah, because again, then you've got a barrier. So then you could still be quite close to people, but you've got a decent sized barrier up. And then when you've finished with that and with doing the nails or whatever, I then turn around and get both people to wash their hands again if they can. If they can't and the nails aren't dry, I don't know what you do because I've never had my nails done.
So would you say that the screen in that situation would be more beneficial than the guard with the mask?
Yeah, because you can have like a letterbox that you can put your hands through.
Mm-hmm.
So again, and then you've got to think about, right, so that person now leaves. We've now got to clean that station down on both sides, start again. So both people wash their hands, that type of thing.
Yeah.
So that's the way I would do it.
Yeah, fab. Thanks, Steve. Thank you.
Anybody else?
My trips to the salon will never be the same again, Steve. My wash and blow dry, never be the same.
I've got to disappear, but just wanted to say thanks, Steve, for your expertise and great knowledge as always. Thank you.
Cheers, Andy. Thank you.
See you
Andy.
Thank you so much, Steve. As always, really, really interesting, informative, and everything else. Super helpful. Thank you. Really appreciate it. And just to let everyone know who's still on the call, 18th of June, 6:30. I know a couple of you have already registered. That's our next HR Connect